Party's position is no private health care. Strengthen the public health care system, hire more doctors and nurses, and have a better run healthcare system where people's needs are addressed, where family doctors are available, where you can, for instance, go to a hospital and have hospital wait times addressed. This is on provincial level, party stance. And also just a better management of the system, so people are not dying right there in the hallways as you enter an emergency room, which is the current situation under this conservative and liberal governments on provincial and federal levels. Now, regarding healthcare, the NDP built healthcare in this country. The NDP under Tommy Douglas made sure it happened in Saskatchewan, and it flowed to the rest of the country due to the NDP's campaigning and principles and policies. And over successive liberal and conservative governments, funding for healthcare has gone down, starting with the liberal government under Jean Chrétien, who I'm sure Ms. Mock will agree with me when I say that he cut the federal provincial transfer payments which went to healthcare services. Billions and billions of dollars he took away so that they can deal with all sorts of fiscal issues. And that is one of the beginnings of our healthcare crisis in this country, due to liberal underfunding of healthcare, of doctors, etc. Now, regarding healthcare, we need to expand healthcare and have better home care, like I said, for seniors. For people at home, you need to get services. Right now, they have years and years on the waiting list. Not private, we need a public solution. Regarding medications, we need a public solution. We need to make sure medications are covered for all citizens and paid for by the government. Again, we can pay for this by reversing a corporate tax cut. So we have so many here opportunities to help the regular citizens have a country where they can have a wonderful health care without having to spend the thousands of dollars, because they don't have that money, because they have good jobs, regular jobs if they're lucky enough, but they don't necessarily have the money for the thousands for medication for health care if we had a private system. Not like the American system. We don't need that where people go into debt.
Your turn, Karen.
Our policies are very similar to what Simon has articulated. The Liberals are very worried about the future of the healthcare system and the crunch that families are finding. We do want to enhance the public education, public healthcare system by, again, ensuring that it's shored up. It needs to be. There's those who talk about user fees. That would make it prohibitive for the most vulnerable. The federal government for the last several years has abdicated its responsibility in funding better healthcare research, in providing better home care that would reduce the costs of healthcare. And so, yes, there are some of those agencies that support home care and keep the health care down that are private companies. But we wouldn't want to support having a two-tier system where people who are wealthy can go and pay for private health care and others will not receive the services that they deserve. So we would like to see the federal government play the role that it should be in supporting the provinces, in supporting the regulations, in supporting the kinds of benefits that Simon articulated, that we of course have articulated for years, and ensure that we maintain and enhance the level and the accord, the health care accord. You'll notice that there isn't even a mention of any of that in the Conservative platform, and that is very worrying. The health care system will be safe with the Liberals.